Expect Fentanyl. And it highlights the dangers of fentanyl and how common it's become for fake prescription pills to contain this deadly drug. Fentanyl is sneaky and it can hide in all kinds of street drugs, and teens should expect fentanyl and avoid taking anything that's not prescribed. Unfortunately, too many families have suffered from the effects of fentanyl. Over 600 people in the county died of fentanyl overdose last year, and youth are especially impacted. Even though less teens are using drugs these days, more are dying of fentanyl than ever before. Studies show us that about 22 teens, which is an entire classroom full of students, died each week in the US in 2022. We must help our youth feel supported and not overdose or die. And sometimes I use an analogy of a waterfall. And so if someone has fallen off the waterfall and overdosed and is drowning at the bottom, we have to provide them naloxone or Narcan to reverse the overdose. This is a medication that's available for free at all 9 of our school health centers throughout the county, and in most pharmacies over the counter without a prescription. We recommend the following steps if you suspect somebody may have overdosed. Check, call, spray, and stay. Check, call, spray, stay. So check to see if somebody is not breathing and try to wake them up. Call 911 and put them on speakerphone. Spray naloxone in their nose, and then stay with them until help arrives. You can't hurt someone with naloxone, and you won't get in trouble for helping somebody who's overdosed. Now, we also have to move upstream and help prevent people from falling off the waterfall and overdosing in the first place by helping provide access to medications for opioid use disorder, such as buprenorphine or Suboxone. And these are available in clinics throughout the county, and we have to connect people with recovery programs as well. Our county health harm reduction clinic and other harm reduction programs in the area have fentanyl test strips that are also available for free. Now, we also have to move even farther upstream and make sure that prevent teens from falling in the river of addiction in the first place. And this means we have to help prevent and address childhood trauma. We have to help teach healthy coping skills. And we have to get rid of old pain medication prescriptions with things like denaturing bags. And we also have to work with law enforcement to help stop illicit fentanyl dealing. The county is working on all 3 levels to help prevent youth fentanyl overdose. And we're grateful for our partnership with Koki's to kick off this campaign. So I'll leave you with 3 main points. If youth are feeling hopeless, you can call 988. It's a national hotline to connect with someone 24 hours a day. We also have a local youth line that teens can text, and they can send the word text to teen, that's text the number 2 teen, to an SMS address 839-863. And they'll get connected to a youth peer mentor who can help talk them through any feelings that they're having. Now, number 2, as a society, we have to help empower kids and teens with healthy coping skills. And we have to have supportive environments at home, school, clinic, church, and in the community. And number 3, teens who want to stop using fentanyl and really want to stop using fentanyl, they need help stopping, and they can visit one of our county clinics to help talk with a medical provider about ways to do this, including discussing a medication called buprenorphine or Suboxone to help reduce cravings and withdrawals. Together, we can stop the rise of youth fentanyl overdoses. Please visit our website, multco.us/health, for more information. Thank you.
Great. I'm going to now hand it off to Molly.
Hey, good morning, everyone. My name is Molly Franks. I'm a program specialist with the Community and Adolescent Health Program, part of the health department. Can you hear me okay? Okay, awesome. So I work with the Student Health Action Council at Jefferson High School. All schools that have a student health center, which there are 9 in the county, also have Student Health Action Council of students who are working on health promotion issues. So we have done some things related to fentanyl this year. And I have a student here with me who's going to talk a little bit more about that. We know that young people are concerned about fentanyl and want accurate and life-saving information to support their friends. So people were eager to be involved in helping to develop this media campaign. Youth gave lots of really insightful feedback about ways to message to young people in a way that is appealing, non-judgmental is really important, and informative. So we had people from a wide range of backgrounds giving input into the campaign. Some people who have personal experience with families or friends related to substance use, and some people for whom this was not an issue that they knew even basic information about. So those are all groups that we want to reach with information. So it was helpful to have feedback from a lot of young people. One thing that people talk about a lot these days in terms of health is mental health. A lot of people are really struggling with mental health issues. And the positive thing is that people are talking much more openly about needing support. And we know that we're not giving adequate support to young people around mental health. So that's something that is really important in terms of prevention. Specifically culturally responsive mental health care is something that there's a huge need for. So that is going to be a really important part of prevention. Also, stigma is real. There is a lot of judgment and shame about addiction and drug use. And so when we are providing support and care, we really need to be non-judgmental to make it easier for people to get the support they need. People who are experiencing overlapping stigmas, racism, homophobia, we need to give support to people in a way that's not judgmental. We know that lots of fentanyl use is happening accidentally. People don't know, they're not intending to take fentanyl, but it's mixed in with a lot of different substances. And so that is part of the issue. And then some people are intending. We need to be able to reach people both when it's happening accidentally and people who are seeking out fentanyl. Youth are very responsive to the availability of naloxone in student health centers, so that is a really important service that we are offering. And we want people to know that they should never use alone. If in case of an overdose, it's life-saving to have someone else there who can provide that emergency care. So we want people to know that mental health support is available and to reach out. An opportunity to get involved. Our people from our Student Health Action Council are presenting a workshop that they did at the school, but they're also going to do it again at the Together for Youth Summit that the Community and Adolescent Health Program is organizing May 18th from 11:30 to 3:30. It's going to be at PCC Cascade, so encouraging people to come to the Together for Youth Summit. There's more information on the Multnomah County Health website, mchealth.org. And I'm going to turn it over to Araceli, who's part of our Student Health Action Council.
Hello, my name is Araceli. I am a senior this year at Jefferson High School. I am also in SHAC Student Health Action Council for 3 years now. And I was also a participant in the focus group. And I just want to share my experiences and why I feel is important. I said that it was informational. Telling me about what fentanyl was and how we could help to solve it. And it helped me form an understanding and opinion about it to pick good messages about fentanyl to my community. And I also said that being in SHAC in general was a great experience because it made me develop new skills and understand more about the health, especially ways that we could help our community here at Jefferson. We also did a fentanyl assembly at our school where we would present statistics, facts, and examples of fentanyl to spread awareness at our school about fentanyl, as it's not really much of a it's not really known here. So spreading awareness is just like number one for me. And why is it important is that it's important to be seen and heard about these things so you can have an understanding about it and form your own opinions about it. Youth in particular are surrounded by media all the time, whether that be on their phone or on the posters at their school. So taking advantage of this and just spreading awareness by either media or here at school would be really, really good to reach out to the youth in general. And yeah.
And Araceli, could you spell your name, your first and last name for everyone?
Yes. First name Aricely, and last name Jimenez, Jimenez. And my first name is pronounced Araceli.
Great. Thanks, everyone. We're now going to start the Q&A portion. Could you all raise your hands, and I will call on you in the order that you raise your hand. Connor.
Hi there. This is a question for Araceli. I know last year around September, Jefferson High School experienced a sophomore dying of overdose. I just want to know how that changed the game about the conversation of fentanyl amongst you and your peers at the high school, and how it impacted the high school as well.
It definitely impacted the school emotionally, because it is an emotional situation, but then it does kind of question more kids and kind of make them more curious about what happened. And like I said, just taking this and spreading the word and telling them more knowledge about this, it just helps, learning about fentanyl and all that.
Tim, go ahead. We can't hear you. You're on mute.
Still at me, you think. Araceli, this is for you as well. Thanks for talking. Kind of what's it like right now on campus and with kids your age? Is this a big topic of conversation, or is there concern, or people talking about using, or I don't know, what's it like?
Personally, for me right now at the school, I haven't heard much of conversation around my classmates about using drugs or fentanyl. But there has been a bunch of students who are curious about it. For example, during our fentanyl assembly, we had a bunch of kids come over and they had great questions about fentanyl. So, I guess that my classmates or just students in general at Jefferson are curious about fentanyl, and we want to provide that for them in SHAC. So.
Can I just follow up then and ask you, how important do you think it is to have like an awareness campaign like this, Expect Fentanyl? How do you think that'll help?
I think it will help by just providing like clear information and not misinformation, because there is a lot of misinformation here at school. Sometimes, especially after that unfortunate overdose, there has been worry and concern from both teachers, classmates, and parents about drug use and how it's being talked about at school, which makes sense. And I think that it's important here at SHAC that we talk about it, so we don't spread misinformation, that we want people to understand, what's going on and what you can do to help others, especially help others, because, like an overdose, you want to kind of spread like less of that so that doesn't happen again. And just knowing that is really great.
Awesome, thank you.
Do we have any other questions? Just as a note, I will be sending out some examples of the collateral that will be posted as some of the bus shelter posters and bus bench posters, and those will come out when I send the press release when this concludes.
Hi, this is Lisa from Coin. Can you hear me? I did raise a hand.
Yeah, we can hear you, Lisa. Yep. Go ahead, Lisa.
Okay to go ahead? Thanks. A couple questions for a couple folks. Araceli, you mentioned that students came up and had a lot of questions. What were the questions that they had? Because the assumption is kids know, don't take a pill that you don't know where it came from. What kinds of questions did students really have on this?
New questions that would pop up would be how do we know when someone's overdosing? What do we do when someone's overdosing? Are there early signs? How do we, look out for these drugs, like for example, fentanyl? How do we know things are being laced with fentanyl? Things like that.
Thanks, that's helpful. Bruno, question, I think it would be towards you, on the campaign itself. The county's paying money to an outside public relations firm for services on this. There's a Song for Charlie organization I'm sure most folks are familiar with locally that's done a tremendous amount of work, has all kinds of materials. Why essentially reinvent the wheel on something like this?
Yeah, thanks for the question, Lisa. Yeah, we work with the Song for Charlie as well, and we've been part of many conversations with them, and they're doing wonderful work. And what we wanted to do here was brand a new campaign specifically related to the forums that we held with students in the county, based on the feedback that we were getting directly from them on what their concerns were. So this new campaign is really an effort to expose a lot of what the questions, the misconceptions, and the misinformation that exists out there, and try and help shed light on that, and do so in a way that is very out there, very visual in the community, both on billboards, bus ads, as well as social media.
Do you think that that message, though, relative to students is effective on those types of materials in those types of places, as opposed to one-on-one students helping students, where, what was just talked about, by Araceli, that really gets to students. In other words, seeing something on a bus, it doesn't really connect. Whereas when you're talking one-on-one with students, I mean, is there any thought to focusing on those areas to really fund students groups at every school?
Yeah, absolutely. I mean, it takes a multi-prong approach to really get to help these messages kind of sink in and take heart. So absolutely, our 9 school-based centers have multiple student groups, multiple options for students to get help, to get treatment, to get naloxone, to learn about how to respond to an overdose. All that's happening on sort of very individual levels. And then all the information we're putting out in the media campaign is really trying to hone in on those messages, reinforce those messages, and make sure we're reaching folks in multiple ways. So yeah, we're trying to an all hands on deck approach here with this.
Thanks.
Tim, you can go ahead.
Okay, thank you. Dr. Bruno, I guess is this meant just for kids, or is it for the entire population that you're trying to reach? I'm sure you can put this out in the release, but I'm just not clear on that.
Yeah, we're really targeting ages 13 to 20 here, Tim, and we really want to make sure that a lot of the messaging that we're doing is based on the input that we're getting directly from teens of that age. Of course, these messages are applicable to not just teenagers, but adults as well. And so, I think it has, a double-edged sword there for sure.
Thank you.
Connor, I saw you had your hand up. Did you have another question?
Yeah, just a question back to Araceli. I know that you're at Jefferson High School. You're in one district of many districts here in the Portland metro area. What message would you like to send to your fellow students that might be in the Beaverton School District, the Hillsborough School District, who might see these ads and, might have questions about fentanyl? What can they do from your experience as a, student their age?
Definitely, if they have any questions, locate, if their school has a SHAC, a Student Health Action Council Club, they could definitely have their questions answered there, or even go to their own health centers at school and have any questions there. But I think that's really all. But also, if they would see things like on the bus, maybe, ask those questions and don't stray away from them. I feel like all questions should be welcomed, no matter how small or big they are.
Thank you.
Okay, I think we have time for about one more question. Are there any final questions? If not, thank you all for coming and learning more about our new campaign, and I will be hitting send on the press release right now. And if you have any follow-ups, you can send them to pressoffice@multco.us. Again, thanks everybody for joining. Have a nice day.